In order to become a social worker that sees people for therapy, you have to pass the licensure exam, the LCSW exam. It's a multiple choice exam, and it is observed to have different passing rates depending on different factors: race, socioeconomic status, and language. After you take the test, which is designed by white people, and just because a person is able to speak English or happens to grow up in white culture doesn't mean they will be a better therapist, obviously. Especially because people need therapists that are like them, that understand their experience, know what they're going through, and can direct them in a way that is meaningful to them to be helpful. What I think is helpful is not going to be the same as what you think is helpful. After someone gets their LCSW exam, they have to continue to educate themselves, get continuing education credits, pay for that, be mindful of that, be intentional with that. And something that gets in the way throughout all these things is gatekeeping of information, paywalls, and language that is more complicated than it needs to be because it is upheld by institutions that value professionalism, shown through intellect. So let's go through this sheet. Not in a comprehensive way, just in a broader understanding so that when you see a scholarly article, this is from the National Library of Medicine, it doesn't automatically freak you out. Borderline personality disorder, we have the authors. Thank you to all of you. It starts by talking about a continuing education activity. Talks about the discussion of the article, the diagnosis of borderline personality disorder, the pharmacology, the pharmacologic, and the psychotherapeutic treatment, okay? Does medication or therapy, talk therapy work for this disorder? And the importance of interdisciplinary team managing patients with BPD. We can't always get medication to work. We can't always get talk therapy to work. We can't get people to stay engaged with their treatment. So we need to have doctors connected to psychiatrists, connected to therapists, connected to job development, connected to caseworkers to help people get better. Introduction. So that's what the article is about. It defines borderline personality disorder, which we already talked about. It shows how it presents. And then we start to talk about how the concept of personality disorder has evolved, how it has come up in psychology, in psychiatry, medication, how it has entered in the DSM, the etiology, I don't even know, is talking about current hypotheses. A lot of mental illness is really unclear, so we have to have hypotheses about where it comes from, how to prevent it, how to treat it, etc. The current hypothesis is that borderline personality disorder is caused by an interaction between genetic factors and adverse childhood experiences. Genetic predisposition to be neurotic or anxious or avoidant or codependent or obsessive or perfectionistic. Adverse childhood experiences, something that was not conducive with your personal, intellectual, emotional, psychological development. Affecting brain development via neuropeptides and hormones. The relative importance of these factors is unclear. We'll talk about a hereditary component of personality disorders. The estimated hereditability of BPD is around 40%. And then it talks about how they can look at that. For example, seeing it in higher rates of twins, and then full siblings, and then half siblings, seeing a higher association between twins than full siblings, than half siblings. Talks about the factors and family domains that contribute to increased risk, although none of them are direct or they don't cause. It's all correlation of many different biological, psychosocial factors. Low socioeconomic status, family adversity, conflict, maternal psychopathology, psychosis issues when your mother is pregnant, parental substance abuse, low warmth and harsh punishment, child abuse, neglect, and low cognitive function can all contribute, can be risk factors for developing borderline personality disorder. Epidemiology. How prevalent is it? So borderline personality disorder is between 0.7% and 2.7%, with symptoms usually manifesting in early adulthood. Pathophysiology. How is this showing up biology in the brain? So neurobiology, looking at nerves and brains. I don't do this part, but that's why I'm saying it, so I can show how someone who doesn't do this part looks at this information. Neuroendocrinology, hormones, that are impacting the brain: structural neuroimaging, looking at brain scans, and functional neuroimaging. Specific genes may be involved with disruptions in the hypothalamic pituitary adrenal axis, consistent with stress-related changes, experiencing stress, and chronic elevation of cortisol, affecting emotional regulation, decreasing the ability to regulate your emotions, and decreasing your ability to control your impulses. Neuroimaging studies have identified differences in the amygdala, hippocampus, and mediotemporal lobes in patients with BPD, which may also be related to self-reported childhood trauma. Trauma, neglect, abuse can have an impact on your brain, and when your brain is impacted, it impacts your personality and your ability to control maladaptive behaviors.